I'm going to start off by putting my PPE on, so my gloves. My name's Louise. I'm a second year paramedic student. I'm going to do a abdominal examination on you today. Is that alright?
Yep, that's good.
Yeah, cool. Can I confirm your name and date of birth?
Daniel Short, 27th of November 1995.
Cool. So the abdominal examination is going to start off with a visual examination. I'm just going to look at you, observe you, and then I'm going to go into a full-on check with percussing, oscillating and palpating your abdomen. So can I please get you to remove your shirt?
Yep.
Now, are you in any current pain?
Not at the moment.
Cool. So, starting off from the end of the bed, I'm just doing a visual observation. Can you please put your hands to your sides? Cool. So, I'm just checking for any treatments such as sick bowls, feeding tubes, or anything like that. Also checking for any scarring, masses, distension of the abdomen, any jaundice, if there's any discoloration of the skin, or any anemia, if they're pale. They're at a current healthy weight, so not too concerned about obesity or anything, and they don't seem to be in any discomfort or pain. Now, so I'm going to start by assessing your hands and arms, so can I get you to do that to your hands? Cool. This, I'm just going to check your nails, checking for any whites or any curving of your nails. Cool. So can you please put your fingers, index fingers like that together? This is just checking for clubbing, and there's no signs of clubbing, so that's cool. Can I get you to put your hands up like that? Thank you. So no redness or any other signs of hands curling in. That's great. Now, can I put your hands back like that and then put your arms forward? And checking for any tremors, but there's no tremors, so that's perfect. Now I'll just check your inner arm, so if you can just roll them out a little bit. There's no bruises or track marks, which is a good sign. And if you could, you can relax now, and then if you could lift up your arm. And there's no abnormalities of the armpit, so that is also a sign of GI malignancy if there was anything. So you can put your arm down now, cool. Now, just going to assess your face. If you could put your eyelids down, your bottom eyelids, cool. And if you could look up, just checking for signs of conjunctiva, pallor, or any jaundice. You can relax now. Now, if you could open up your mouth. There's no signs of redness. Could you please stick your tongue out? So there's no dryness, and if you could put your tongue up. Cool, no abnormalities down. So I'm just going to check and palpate your lymph nodes in your neck. Is that alright?
Yep.
Cool, if you could sit forward, that'd be great. I'm just going to start by coming underneath, palpating, and going into bridge, and then back up. Checking the lymph nodes for any inflammation, which could indicate infection or a GI malignancy. Cool, thank you. You can sit back now. Now I'm going to visually observe the chest for any abnormalities such as spider nevae, which is just a redness of the chest that extends around, which could indicate a chronic liver disease, or if there is a sudden increase in male mammary glands, or if there's any current hair loss. So you haven't lost any hair over your chest in? Cool, thank you. Now I'm going to move on to your abdomen. So have you got any pain at the moment?
No.
Cool. I'm just going to lie you supine. Is that alright?
Cool.
Just sit forward. Cool. Just lying you down. Thank you. If you could put your hands down to your sides, that'd be great. So the abdomen is sectioned off into 9 quadrants, so across here and across here. What I'm going to start doing is just visually observing for any scars from previous surgeries, any distension or masses in any areas, for any stoma bags or anything, but I'm also going to start by palpating all 9 quadrants lightly and then deeper. So I'm just going to lightly go from my palm to my fingers across in each region.
That's cool.
Yeah. And tell me if you feel any pain or any discomfort.
Yep.
Now I'm going to go deeper.
Cool.
This is just checking for signs of any guarding, any masses or any tenderness. So I'm going to start by palpating your organs and stuff. Is that alright?
Yeah.
Cool. I'm just going to start with your liver. So if you could nicely take deep breaths in, and I'll push while you're taking your deep breaths. Cool. Cool, and I'm just going to palpate your spleen now. So just keep taking your deep breaths. And I'm just going to palpate for your kidneys, so it's just going to be a rocking slightly. So if you could just move this arm down, that would be great. Cool. And on the other side. And I'm just going to palpate your aorta, so you don't need to keep your deep breaths, just breathe normally. And this is checking for any abnormal pulsations that could indicate a AAA or acute aortic aneurysm. Okay, I'm now going to start by percussing your organs. So I'm going to do your liver, then your spleen and your bladder, and then I'll do some shifting dullness across your abdomen. Is that alright?
Yep.
Cool. So there's just going to be some tapping. If I could get you to roll on your side away. Cool, we're just going to have to lie here for 10 seconds. This indicates once I percuss again if there's any free fluid flowing in the abdomen. Now you can roll back over. Now I'm just going to auscultate, and I'm going to auscultate your any bowel sounds. For any bowel sounds, your aortic birds and renal birds.
Cool.
Cool. Cool, thank you Dan for letting me do an abdominal examination on you. You can sit back up and I'll give you your shirt. Okay, to complete this examination I would examine the external genitalia. I could also assess for hernial orifices and also perform a rectal exam. In summary, Dan is a 19-year-old male with no peripheral stigmata or GI pathology. His abdomen was soft and non-tender. There were present bowel sounds and no abnormality, and this was a normal examination.